Imagine you are a patient in the hospital. It's around 7 p.m., 7 a.m., and the nurse starts to come in, makes a little conversation with you, and then takes her stethoscope out, puts it to your chest, puts it to your belly. You may be wondering, what is this nurse doing? This nurse is performing a head-to-toe assessment. Today I'm going to inform you how to perform a head-to-toe assessment from a nursing standpoint. I am currently a licensed practical nurse. I am in school for my RN, and I work on a medical surgical unit where I perform a head-to-toe assessment every single shift. Today I will specifically cover what a head-to-toe assessment is, how to perform one, and why it is important. Assessing your patients is probably the most important part of the nursing field. I'd like to begin by first explaining what a head-to-toe assessment is so you can better understand the process how to do one. According to the College for People 2022, the nursing head-to-toe assessment is the most important part of the nursing practice. It is called the roadmap on how to further treat your patients. Without the nurses performing these head-to-toe assessments, it would not allow the doctors to understand what is going on with the patient. Every patient seen is going to receive this head-to-toe and will better help us understand the patient's status. A head-to-toe assessment refers from the physical examination or the health assessment. There's many important components that we will be going over today. Quite frankly, a head-to-toe assessment starts exactly how it sounds, from the head to the toe. So I will be using Brianna as my visual aid today to show you how to perform one. So starting with the head-to-toe, I'm going to introduce myself. Hi, I'm Maddie. I'll be your nurse today. Then I would ask Brianna to tell me what her name and date of birth is. Doing this is going to verify that I do have the right patient and that I would be documenting correctly. Her doing so leads into my first assessment, the neuro or the head. This is asking Brianna orientation questions. So what is your name and date of birth?
Brianna, 8/24/89.
Do you know where you are right now?
The hospital.
And why are you here?
I broke my toe.
Perfect. And then what year is it?
2022.
And who is the president?
Biden.
So doing this, it shows that Brianna is alert and oriented ×4. Patients can be anywhere from alert to self to ANO ×4. This better shows the nurse if the patient is confused, if they're a little forgetful, anything from that standpoint. Then going on, I would start looking at Brianna's face, looking at symmetry. Showing this is good to show for stroke patients if one side is slouched, or if Brianna is slurring her words, which is also part of the neurological. Then I would begin looking at Brianna's eyes. This is with a pen light. It's called Perla. It's pupils round, equal, reactive to light, and accommodation. Seeing that, I can see that Brianna has glasses. If a patient isn't wearing glasses, I can ask if they do have any visual impairments. At this time, it's also good to go to the ears and seeing if they wear hearing aids or if they are hard of hearing. At this point, I can go down to Brianna's arms and legs, or arms and hands, but it is important to, with each step, look at her skin. I can do this throughout the head-to-toe assessment. With each system I go over. So hands kind of play in with the neurological aspect with strength, because I, again, could be assessing for a stroke at the same time. How I mentioned with the face, with one side being slouched, that could be with strength in her arms and her hands. So at this point, it would be a good time to ask Brianna to squeeze my fingers, and I would have her do them with the same other hand at the same time, because that would be bilateral strength, or if it wasn't. I can ask her to push down on my hands and push up. That's also showing the strength. Then while I'm doing that, I will also make note to, again, look at her skin. Does she have any IVs in? Does she have skin tears? Does she have a dressing or some type of wound on her? At that point, I would want to make sure that I'm looking underneath to assess that as well. Then moving on, I can go to Brianna's chest. While you're doing a head to toe, you do want to make sure to inform your patient what you are doing. You want to make them feel involved and safe in their care. You never want to touch a part of a patient without them being informed. As nurses, we do get kind of caught up and don't realize what we're doing because we do it so often, but you do want to make sure that you're explaining each step. So I would just say that I'm going to listen to your heart, lungs, and your belly. I would take my stethoscope and I would place it on her chest. I would listen to each side. At this point, I would ask Brianna to take a deep breath in through her nose, out through her mouth. I can look at her chest at the same time, seeing if it's rising equally, how her lungs sound, if she's breathing heavy, etc. And then I'd also want to make sure that I'm listening to her heart as well. At this point, I would want to note if her heart was beating fast, if it was slow, or if it wasn't having a regular rhythm. Moving on, I would go to her belly. I would listen to 4 different spots. We call them quadrants. You want to start on the right side and kind of snake down. Into each quadrant, we want to listen for maybe a little bubble. If you don't hear it, then that would be absent. If it takes a while, that'd be hypoactive. If you do hear it, that's active. And then if you're hearing tons of it, would be hyperactive. At this point, it's a good time to ask Brianna when she had a bowel movement, but I won't ask her to tell us. At this, I would also want to know what kind of bowel movement it was. Maybe uncomfortable for the patient, but we hear it every single day. So then moving on from that, I'd also want to know what kind of diet Brianna is on, if she's been having trouble eating, or if she is passing gas, or if she's not. Moving on from the belly, I would also, listening to her bowel sounds, I would also be feeling for firmness, looking to see if she's bloated or distended, as we would say, if it is soft or rigid, or if she is like flinching, which is guarding, and seeing if it was tender to touch. Then moving on, I would go to the urinary system. This one's pretty quick. I would just ask if she urinates on her own or if she has some type of device, like a bag, or if she uses a catheter. Then after that, I would move on to her legs. Same as the arms, I would be assessing the strength. This is plantar and dorsiflexion. So pointing down is dorsi, pointing up is plantar. So I like to say for plantar, toes to your nose, and dorsi is acting like you're pressing on a brake or the gas. Again, I would be wanting to do this simultaneously with both her legs. And then at the same time, I'd be asking if she has any calf pain. Calf pain would be signs of a blood clot. I would want to feel to see if it was warm or hot to touch. This is also called a Homan sign. Moving on to her feet, I would want to look and see if she had any wounds again. This is common for people with diabetes. Looking at her toes, I would want to check capillary refill, which I would also check on her hands. That's with blood flow. And that pretty much covers the head to toe. I could go on and on and on, but that would be a bit much because there is tons of stuff to go over with the head to toe assessment. So moving on, I would just like to say how important it is for patients to receive the head to toe assessment. Sadly, doctors are not there 24/7. Nurses are the eyes and the ears for our patients. We advocate for them, and we want to be on top of their care so they can receive the best care they possibly can. So doing a head to toe assessment is done for many different reasons. We always want to do it at the beginning of our shifts, or if we feel like one is needed, which is also a focus assessment if we're worried about a particular part of the body. decision-making skills are applied during the nursing process and provide a decision-making framework to provide and develop a plan of care for the patients. And we also want to make sure that we have an evidence-based practice. This is coming from the union's PACE of 2021. Every nurse does have to develop a care plan, which I could go on about that as well, but I won't. Sadly, doctors aren't always around, and we just want to make sure that we are providing the utmost care for our patients. So I know most of you, I know we do have 2 nurses in the room as well, but most of you listening to this are not nurses. But just because you are not nurses doesn't mean you can't perform your own head-to-toe assessment. We always want to make sure that we are listening to our bodies. If we feel like something is wrong or off, we should go see a doctor and get that educated response. And you can always look at a family member or someone in your family and advocate for them and to go get a checkup or go be seen if it is important. So I hope you all learned something with me today and saw how to perform a head-to-toe assessment. Thank you.
That was